Hello everyone. So here in this video we will explain the anatomy of tympanic membrane. So already in the previous lectures of the middle ear cavity we have seen the tympanic membrane is forming the lateral boundary for the middle ear cavity. So this is the tympanic cavity or middle ear cavity. In its lateral wall we can see the tympanic membrane. So this tympanic membrane is a translucent partition between the external ear and the middle ear. External ear consists of the pinna and external acoustic meatus. So at the medial most end of the external acoustic meatus we can see an obliquely placed membranous structure, that is tympanic membrane or the eardrum. Functionally this tympanic membrane is very important because the vibrations produced by the hitting of the sound waves on the tympanic membrane will receive this vibration and that will be transmitted through the ear ossicles towards the internal ear. So now let us learn the detailed structure of the tympanic membrane. So structurally this is oval in shape and this is placed at an angle of 55 degrees with the floor of external acoustic meatus. So this is the cartilaginous and the bony part of the external acoustic meatus, and this tympanic membrane is placed obliquely so that it will form an angle around 55 degrees at the floor of the external acoustic meatus, and it is directed downwards, forwards and laterally. So this is the direction of the tympanic membrane. And this obliquely placed tympanic membrane that will show two surfaces. One is outer surface that is facing towards the external acoustic meatus. Second thing is inner surface that will be facing towards the middle ear cavity. Outer surface which is facing towards the external acoustic meatus is concave, and the inner surface which is facing to the middle ear cavity is convex. And there is a maximum convexity point in the inner surface that is called as umbo, where the handle of the malleus will be attached. The concave outer surface will be showing more or less nature of the ordinary skin. That means the skin over the external acoustic meatus will be modified and that will be reflecting to cover the outer surface of the tympanic membrane. But remember, the inner surface will be lined by the epithelium of the middle ear cavity. Texture wise, the circumference or the peripheral aspect of the tympanic membrane will be comparatively thick than the central aspect. And this peripheral thick portion will be fitting to the tympanic sulcus, that is the bony sulcus in the temporal bone, which will be receiving the peripheral margins of the thick tympanic part of the tympanic membrane. But remember, at the upper aspect, this tympanic sulcus is deficient and that will be forming tympanic notch. Especially the pars flaccida part of the tympanic membrane will be fitting to the tympanic notch. Shortly I will explain what actually the pars flaccida is. Remember, in case of tympanic notch, there are two ends, anterior end and posterior end. From anterior end and from the posterior end, you can see the fold-like appearance. Two are there. One is in anterior aspect, one is in the posterior aspect. These are called as malleolar folds. So there are two malleolar folds: anterior malleolar fold, posterior malleolar fold. So these anterior and posterior malleolar folds are getting inserted or attached to the lateral process of the malleus. And the part of the tympanic membrane between these two malleolar folds, this part is comparatively very thin and loose in appearance. So that's why this particular part is called as pars flaccida. Remember, this pars flaccida part is related to a nerve called as cauda tympani nerve of the facial nerve. So this is the facial nerve. From the facial nerve we have cauda tympani nerve that will be related to the pars flaccida part of the tympanic membrane. And remember, this pars flaccida part there is a tendency to get ruptured easily when compared to the pars tensa. The part of the tympanic membrane, the major part of the tympanic membrane, other than the pars flaccida, this part is comparatively tensed or stretched. This particular part is forming pars tensa. So there are two parts, pars tensa and pars flaccida. Next we will explain the structure of the tympanic membrane. So if you take a cross section of the tympanic membrane is formed by three layers. Outer layer is called as cuticular layer, middle layer is called as fibrous layer, and the inner layer mucous layer. The outer cuticular layer is showing nature of the skin, that's why that's called as cuticular layer. And the middle fibrous layer is made up of fibrous tissue, and there are two types of fibrous tissues or fibers are arranged in two layers: superficial layer, that is radiating, and the deep layer or the inner layer, that is circular. And the inner layer is called as mucous layer, that is lined by the lining epithelium, that is low columnar ciliated epithelium, that is the lining epithelium of the middle ear cavity. Now let us see what are the arteries which are supplying to the tympanic membrane. So the outer part is supplied by deep auricular branch of maxillary artery, and the inner part, again we have two arteries are there: anterior tympanic artery and posterior tympanic artery. Anterior tympanic artery is a branch of maxillary artery. Posterior tympanic branch is artery is a branch of stylomastoid artery. Next is venous drainage. The venous blood from the tympanic membrane is draining to external jugular vein, especially the venous blood from the outer surface of tympanic membrane. But venous blood from the inner surface will be draining to the transverse sinus, and few venous blood will be draining to the venous plexus surrounding the eustachian tube. Next, we will go through the nerve supply. The outer surface of the tympanic membrane is having two nerves to supply. Antero-inferior part is supplied by auricular branch of the auricular temporal nerve, and the posterior inferior part is supplied by auricular branch of vagus nerve, and the inner surface is supplied by tympanic branch of glossopharyngeal nerve. Last, we will see what are the clinical conditions related to the tympanic membrane. So first thing to explain is meringotomy. Meringotomy is the artificial incision made on the tympanic membrane. This can be done at the posterior inferior quadrant of the tympanic membrane so that the coda tympani nerve will be spared. And this meringotomy can be performed especially if there is excess accumulation of the pus or the inflammatory fluid in the middle ear cavity. In order to drain the inflammatory fluid, this meringotomy can be performed. What is cone of light? So once if you are examining the tympanic membrane with otoscope, so the light reflection can be seen at the antero-inferior quadrant of the tympanic membrane. So this is called as cone of light. So that's all about the tympanic membrane. And thank you for watching this short video explaining the anatomy of tympanic membrane.